In this podcast episode, the host sits down with Dr. Chris Palmer, a Harvard psychiatrist and expert in the relationship between metabolic disorders and psychiatric conditions. Dr. Palmer shares alarming statistics from a study that followed over 5,000 children from birth to age 24, revealing that those with the highest levels of insulin resistance at age 9 were 5 times more likely to develop a psychotic disorder by the time they reached 24. This staggering 500% increased risk highlights a critical connection between metabolic health and mental well-being, suggesting that the root causes of many mental health disorders may be more biological than previously understood. Dr. Palmer discusses the exponential rise in mental health diagnoses over the past decade, including anxiety, depression, ADHD, and bipolar disorder. He points out that while the rates of these conditions have surged, the underlying causes are often overlooked. For instance, the tripling of ADHD diagnoses since 2010 cannot be solely attributed to an increase in poverty or abusive households, as those factors have not seen a similar rise. Instead, Dr. Palmer argues that metabolic dysfunction is a significant driver of these mental health issues. Metabolic dysfunction refers to the body's inability to effectively process food, oxygen, and essential nutrients, which can lead to various health issues, including obesity, diabetes, and mental health disorders. Dr. Palmer emphasizes that metabolism is not just about weight. It encompasses the biological processes that fuel our bodies and brains. When metabolism is disrupted, it can manifest as both physical and mental health problems. He asserts that many mental health conditions are interconnected with metabolic health, and addressing the latter can lead to improvements in the former. Dr. Palmer highlights the importance of nutrition, sleep, and physical activity in maintaining metabolic health. He notes that many children today are consuming ultra-processed foods, which are linked to obesity and subsequent mental health issues. The prevalence of these foods in schools and homes contributes to a cycle of poor health outcomes. He argues that the current approach to mental health treatment, which often relies heavily on medication, fails to address the root causes of these disorders. Instead, he advocates for a holistic approach that integrates physical and mental health treatment. Throughout the conversation, Dr. Palmer expresses concern about the overprescription of psychiatric medications, which can lead to weight gain and other metabolic issues. He acknowledges that while medications can be life-saving for some, they often do not address the underlying problems and can exacerbate health issues. He urges mental health professionals to consider the broader implications of their treatments and to explore lifestyle interventions as a first line of defense. The discussion also touches on the body positivity movement, which promotes acceptance of all body types, including obesity. Dr. Palmer cautions against this approach, arguing that while acceptance is important, it should not come at the expense of acknowledging the health risks associated with obesity. He emphasizes that obesity is a symptom of metabolic dysfunction, and ignoring this reality can lead to further health complications, including mental health disorders. In a thought-provoking segment, Dr. Palmer addresses the impact of hormonal contraceptives on women's mental health. He cites research indicating that women under 20 who take birth control pills are 3 times more likely to experience suicidal thoughts. This statistic underscores the need for women to be aware of the potential mental health implications of hormonal treatments. Dr. Palmer encourages open conversations between women and their healthcare providers about the risks and benefits of birth control, particularly in relation to mental health. Dr. Palmer concludes the episode with a powerful message about the importance of understanding the interconnectedness of physical and mental health. He urges listeners to take proactive steps in their own lives, such as improving their diet, increasing physical activity, and prioritizing sleep. By addressing metabolic health, individuals can potentially mitigate the risk of developing mental health disorders.